Welcome to the Department of Health. Our department's history is unique among all our counterparts in the United States, a history that's grounded in our host culture. Before Western contact, Native Hawaiians were a healthy people, free from most diseases due to geographic isolation, following natural healing practices guided by the earliest health providers, amongst them the Kahuna Lapa'au. When Captain Cook arrived in 1778, the population was estimated to be around 250,000, and he described the people as robust and healthy. Lacking immunity to diseases, the Native Hawaiian population declined dramatically with the coming of people from other parts of the world. Major epidemics swept the islands, including measles, flu, syphilis, cholera that killed 15,000 in 1804, and smallpox, which in 1853 killed nearly 6,000. Missionaries noted that a great majority of children born in the islands died before the age of 2. Infant mortality, disease, and lack of potable water and sanitation were among many issues facing the people of Hawaii. A century after Western contact, the Native Hawaiian population was decimated to 1/5 its size. In response to the smallpox outbreak and realizing the sense of urgency, King Kamehameha III, Kauai Keauli, established the first Board of Health in 1850 for the port of Honolulu. Ships were quarantined up to 42 days as prevention of smallpox transmission. In 1853, the Board of Health was expanded to serve all of the islands of Hawaii. After Kamehameha III, other Hawaiian royalty became leaders in public health. Kamehameha IV, Alexander Liholiho, and his wife Queen Emma established the Queen's Hospital in 1859. Kamehameha IV and community physicians also started Hawaii's first medical society. With the Native Hawaiian population so decimated, other ethnic groups were brought in, mostly as laborers, from different parts of Asia to support the booming agricultural economy. It was also hoped that intermarriage with the new migrant populations would result in a rebuilt population. Migrants, however, also brought new diseases, such as leprosy or Hansen's disease and bubonic plague. As plantations could not afford to have unhealthy workers, it began to provide medical care to laborers. However, laborers often lived and worked in unsafe and crowded situations with poor sanitation. Public health efforts began to expand to address the growing population. By 1900, rural hospitals were established on all islands. In 1906, the first public health nurses were employed for tuberculosis control. In 1920, the unions advocated for better wages, housing, and health care. And in 1923, the Board of Health started a dairy campaign to make milk safer. After statehood in 1959, the Board of Health was reorganized to become the Department of Health. Hawaii can be uniquely proud that it can trace its Department of Health to the Hawaiian monarchy and is the oldest state Department of Health in the nation.